Back in May, the CDC said it was sending Ebola guidelines to hospitals around the nation. To your knowledge, were those guidelines received, and are nurses receiving adequate training to deal with Ebola?
Probably the guidelines were received, but they're probably still in somebody's desk or being looked at. Our studies clearly show that nurses are not being given the education and training they need in our hospitals by our own survey. So we're extremely worried about the situation.
Ma'am, why do you not believe that they are receiving proper training?
Well, the CDC guidelines are merely guidelines, and when you have over 5,000 hospitals in the United States that can choose which guidelines they want to implement, you have sort of a free-for-all, and that's what we're concerned about. We would like consistent, mandatory standards for all of the hospitals to follow.
Professor Gostin, Jeffrey Levy is Executive Director of Trust for America's Health. That's a nonprofit focused on disease prevention. He told my colleagues here at Bloomberg News, quoting here, "While it's always important to find dollars in the context of an emergency, it is just as important to sustain our capacity to respond." How would you assess the country's capacity to respond to the Ebola virus?
Well, first of all, I don't think there's going to be a major outbreak here, so I just want to calm some fears about that. On the other hand, the cases in Dallas with really apparent breaches of protocol in almost every respect, not just the infection of the nurse, but also the quarantine of four contacts of Mr. Duncan were very badly handled. And I actually think that we need to do better with our public health capacity. The CDC's funding has been cut. State and local health departments have been cut. And I think this just exposes our vulnerable underbelly.
Ms. Berger, in the impact zone in West Africa, some healthcare professionals, they've become sick, and some have refused to work because of fear of contracting the virus. That is where the international community has to step in. Are medical professionals here in the United States answering that call in great enough numbers to make a difference?
It really does not feel like the medical profession has been responding in adequate numbers. It's interesting to note that Cuba has actually sent more medical health professionals than the United States. And I think we really need to step up to the plate, because if we don't stop the spread of Ebola in West Africa, it will spread globally. And what the nurses want to say is that we don't want to spread fear. We want to spread readiness and education. And we're trying to make sure that we can hold our employers accountable to providing that education and training.
Professor Gostin, let's talk about that readiness and specifically about airport screenings. Will screenings of passengers work, or are they a take-charge approach designed to lessen people's fears without yielding any tangible results?
Well, you know, I think what we've introduced is reasonable. It's measured. It's narrow, only affecting 150 people per day who originate from one of the 3 affected countries. But having said that, it probably won't work. It'll make the public feel slightly safer. But even during SARS, when we did mass airport screening in Canada and in Asia, out of hundreds of thousands of cases, we actually never found a real case of SARS. We probably won't find a real case of Ebola either. And there'll be lots of false positives. People with malaria, and it's also coming up the peak influenza season. So it's a reasonable thing to do. I'm not against it because it's not an overreaction, but I don't think we can expect to keep us safe. What will keep us safe is strengthening our public health infrastructure here in America, and also getting the reservoir of infection, which is currently out of control in West Africa, under control.
Ms. Berger, when it comes to self-monitoring of healthcare workers, what are the standard protocols to be followed, especially in emergency rooms, which, as you know, are the first point of hospital entry for ill patients?
Well, I think that's the problem that we're dealing with right now is it's pretty much hit or miss when a patient presents in the hospital. In Sacramento, we had a case where a patient sat in the emergency room for up to 2 hours before they actually triaged the patient and got them in the isolation room. So what we really want to make sure is that people in the healthcare field know what the drill is, know how to do it, and can implement it at a moment's notice, because we even have computer online booking of appointments, so patients can show up anywhere.
Professor Gostin, the CDC Director Tom Frieden is rejecting calls from some members of Congress to ban travelers from Guinea, Liberia, and Sierra Leone from entering the United States. What right does an American citizen have to re-enter the country even if they are showing signs of illness?
Well, first of all, I do agree with Tom Frieden. I think it would be a horrible idea to ban travel. I think it would make us much less safe because Ebola would just run out of control in the region, and that would put us at risk. So I think it's a very, very good idea to reject that claim.
I agree, actually, myself. I think that we can't wrap this country in saran wrap and expect to not be exposed to these diseases. And I think preparation and education is actually the key to stopping the spread.
Ms. Berger, let me get you the last word in here. We have about a minute left. I wanted to ask, have you been in contact with any nurses or healthcare professionals who've actually been on the ground in the affected areas? And if so, what have they told you?
No, I have not been in contact with them, but we are making sure tomorrow that we have a call-in show where nurses can call in and ask questions and get support. So we'll see what happens tomorrow.